Hi, so we are very happy to be here at Vanderbilt Stalworth today. It's an opportunity for us to see staff, meet a few patients, and we get to do this quarterly report on site at one of our hospitals. Now, some of you may or may not be aware that Vanderbilt Stalworth was our very first joint venture hospital that started some 34 years ago. So we're very proud of the team here and what they've accomplished over those 34 years. Thanks. Our ITG group is our largest department for the home office at close to 250 people. So they help the company in so many ways. Anything that is electronic or digital or system-oriented, IT has their fingers all over it. You know, the very patient-centered focus. So they have, from day one, they have wanted to be a strategic partner with the company in terms of helping us be successful. So that is how IT separates itself and is a critical part of our team. Data integration, if you think about, there was a time when we'd have to go out and access maybe 5 or 6 different reports to get the information that we would need, that now, because of the data integration, now it's all in one spot. And that was built internally with our ITG team, building the Beacon management system, which has evolved with time. So they've just done a terrific job, and once again, ITG has helped us access that material. ACEIT has a great history. It goes back to 2009, and probably started thinking about it actually back in 2008, when all the acute care hospital systems were moving towards a digitized electronic medical record. We made a financial commitment. We didn't get any government funding to do this. It was a large bite for us at the time from a financial perspective. But when you think back about it now, and we've had this in place in all of our hospitals since 2018, how successful ACEIT has been. And I believe to this point, we are still one of the few post-acute providers out there with a fully integrated system that is reflective of what we do inside of an inpatient rehabilitation hospital and not built for another setting like a system built for an acute care hospital. So ACEIT has been a huge success, and once again, I credit our ITG department for helping to make it a success. If you think about the fact we'll have close to 200,000 discharges that goes into that data system every year, there is significant data that we can work with Oracle Cerner in mining that data to use it to create clinical best practices, to create fall risk programs, to create and support the REACT program. So it's that data that we are levering to our advantage. The second quarter was very similar to the first quarter in terms of we took a great deal of momentum into the second quarter relative to patient volumes. We've seen both total discharges and same-store discharges have really nice growth. It's reflective of the ongoing demand for our services. We have been able to add 5 hospitals to date as part of our de novo program. We still have a couple left to bring online by the end of the year. We have been able to address some of the inflationary labor concerns that we've talked about. We've done a nice job of hiring new employees to fill some of these slots that we've had, particularly around nursing. So, you know, we set out the year with the focus on growth and really managing the labor side of our business, and we've seen both of those really make some really nice progress. Now, we wouldn't be able to do this without ITG, particularly around the de novo program. When you think about it, they come in, we have a building set up and equipped, but yet somebody still has to come in and make sure all the systems work, do orientation around ACEIT, make sure we're hooked up with all the interfaces we have to have, whether it's pharmacy or lab, everything it takes to make a hospital be prepared for day one. So I want to thank our entire staff for helping to continue with the progress we've seen on the volumes, on the new hospital development, on the outstanding patient care, the discharge back home, the patient satisfaction, everything that we've seen that surrounds us to be a high quality provider. We couldn't do it without our staff front and center, And we couldn't do it without integrating some of the technology and systems approach that we've talked about here relative to the support and role of ITG. So thank you all.